Hello, my name is Nicholas Cohen. I'm a doctor in Cleveland, Ohio, and I'm here to talk to you about breastfeeding. Here are 10 tips to know about breastfeeding. Tip number 1. It's recommended that all babies be breastfed from age 0 to 6 months. That means breastfeeding should be the only thing your baby gets for the first 6 months of life. Tip number 2. The benefits of breastfeeding for the baby. For babies who breastfeed, there's less risk of diarrhea, pneumonia, ear infection, and urinary tract infection. There's less risk of atopic dermatitis. And in the long run, many studies show that there's decreased risk of obesity, childhood cancer, heart disease, type 1 diabetes, and many studies show that infants who are breastfed tend to have slightly higher IQs than those that are formula fed. Tip number 3. There are many benefits of breastfeeding for mothers as well. Breastfeeding improves weight loss after pregnancy if breastfeeding is done for at least 6 months. It decreases stress thanks to hormones that are produced during breastfeeding. In the long run, it decreases risk of breast and ovarian cancer. Many studies show that it decreased risk of osteoporosis and bone fracture, and still other studies show that it decreases risk of heart disease. Another benefit to breastfeeding is that it saves about $1,000 in the cost that would otherwise be spent on formula, and raising a baby with breastfeeding has a less chance of needing doctor's visits and hospitalizations, so it decreases the cost of healthcare. Tip number 4, how to breastfeed. There are a variety of different positions that are good for breastfeeding. The most important thing about any position you choose is that the woman be comfortable with breastfeeding and that the baby doesn't have to turn his or her head to nurse. It's important each time you breastfeed to use both breasts and to alternate which breast you use first. This will ensure that both breasts are used equally. Tip number 5, how often to breastfeed. Feed babies as often as they want to eat. Signs that a baby wants to eat are they move their hands towards their mouth, they suck on their fists and fingers, they're fussy, agitated, flail their extremities, or cry. Each time you feed, you should feed around 10 times a day, and make sure a baby is fed at least every 4 hours. That means if it's been 4 hours since the baby has fed, even if they're sleeping, you should wake them up and feed them. Each time you feed, you should feed about 10 minutes from each breast. Tip number 6, how to know your baby's getting enough milk. Your baby should be weighed by a healthcare provider on the 3rd to 5th day of life, and then again on the 2nd or 3rd week. It's typical for infants to actually lose weight when they're born, and by day 5 to lose up to 7% of their birth weight. It's also expected that their weight will be regained by 2 weeks of life, and that they'll double their weight by 4 months. You can also know that your baby's getting enough food by the number of wet diapers. There should be at least 6 wet diapers per day, and the diapers should contain clear or yellow urine. It's a sign that your baby's not getting enough if the diapers are dark yellow or if there are less than 6 diapers a day. And finally, number of stools is another good way to gauge if a baby's getting enough food. There should be 4 or more stools per day in the first month of life. Tip number 7. For many women, breastfeeding can cause soreness of the nipples. And here are some tips to use to help prevent and to alleviate the pain of breastfeeding. It's important to make sure that your baby's in the correct position and latching on well. It's important to make sure that you are feeding regularly and frequently, and that the breast is being emptied each time. If you still have soreness, you can try cold compresses, breast massage, milk ejection between feeds, And then if that doesn't work, acetaminophen or ibuprofen. If there's actually nipple bruising, try a purified lanolin. Brand names are Lansinoh, Lansinoh, or Purelan, Purelan, or hydrogel dressing. Examples are comfort gels and soothies. These provide moisture to the nipples to facilitate healing. You can also use breast shields to protect the nipples from friction between feeds. And if breast redness and swelling and soreness continue despite all of these recommendations, you can try APNO, otherwise known as all-purpose nipple ointment, which contains an antifungal, an antibiotic, and an anti-inflammatory ointment that can be applied to breasts after feeding and can be left on the breast before the next feed. Tip number 8, what else besides breast milk? If you're breastfeeding, it's also important to supplement your baby's diet. Vitamin D is recommended, 400 international units daily. Iron should also be started, and this should be started at 6 months of age. You should make sure babies get at least 2 ounces of iron, 2 ounces per day of an iron certified cereal, or pureed meat, which contains iron. You should also make sure your baby's getting enough fluoride. Fluoride supplementation starts at 6 months and is only recommended if the water supply in your community does not contain a sufficient amount of fluoride. You should ask your doctor if the water in your community contains enough fluoride. B12 is recommended for mothers who are strict vegetarians. Infants whose mothers are strict vegetarians who are breastfed need B12 supplements. Furthermore, if the mother eats fish, she should avoid certain fish which contain high amounts of mercury, which can pass into the milk and cause neurocognitive problems. The fish to avoid, because they are highest in mercury, are shark, swordfish, king mackerel, or tilefish. And in any case, if mothers who eat fish should limit their total amount of fish to 2 servings per week, because all fish contain at least some amount of mercury. Tip number 9 is to see a lactation specialist, especially if you're thinking of quitting breastfeeding. There are many ways to see a lactation consultant for free, and lactation consultants can provide great advice for how to address problems associated with breastfeeding, as well as to provide encouragement for women who are not sure of whether or not they want to continue breastfeeding. And tip number 10, believe in yourself. The number one reason that women stop breastfeeding is they don't think that they're capable of providing enough milk. Believe me, you can provide enough milk, and it's a great thing for both you and your baby. So good luck with breastfeeding, and thank you for listening.